Can I just ask the question as to, I mean, I know obviously you said you can put those 5 visits down to 1. Is there not a risk that obviously if the patient comes into the surgery, the things that are picked up at the same time, and if they're not coming as frequently or they're picking something up on the internet or on their records, that they might not realise that there is something wrong and they could actually fall through?
Yep. Remember I said with all technology there's an opportunity and there's a risk. And we've got to somehow think about how we can maximise the opportunities and minimise the risks. You've got the risk where an individual can actually order all their food online by going to Tesco.com. They can order repeat prescriptions online. They can get a chemist to drop it off or when they do their exercise. What are we doing for obesity, etc., etc. So yes, there are risks as well as opportunities.
Sorry, you know my position.
No, I want to support it really. And certainly when I had the privilege of sitting on the National Care Record Development Board, we discussed this issue. And I'm pushing very hard as much as I can at the very highest level of the country to say we need a framework so the public know when I disclose something and when it's recorded, how would it be shared? And I think we do know is that the social services, a member of an employer, a social worker has certain statutory requirements to deal with information which are different to that of a health professional. And I wouldn't recommend any of my patients to actually show their record to a social services patient if they thought, social service worker, if they thought there was something in there which might actually set off that person's duty to actually respond to something about child care or whatever. Having said that, if, as you think about ARMA's patient, if there is a consensual process whereby you are 76 years old, and forgive me, you've got multiple sclerosis, and actually you are finding it very difficult to cope and you can't see, and it's becoming more and more difficult, and there isn't in fact a continuous information sharing, and there isn't in the National Health Service, there really is not. At the moment, it'll be 2 or 3 weeks or months before I actually know what's happening to you in hospital. You will, with this consensual process, if you wish to do it, be able to take a local doctor's record and say, look, we have got a secure system here, or we think it's a secure system. I would like you to see the record. But more than that, you can navigate them through the record yourself, but I don't want you to see this bit. And I think that's the bit I want the Minister for Health, Alan Johnson, to understand.
She's my third in dealing with.
Yeah, I agree.
If I share, I think the challenges that we have within the local community, health and social, there are a number, but I think the 2 big ones that I really want to flag up is one, lack of knowledge amongst patients and the public. It's great to see so many of you here, but there's still many thousands out there that know nothing about this. So there's one thing I'd like you to do is to go back into your communities, go back into your organisations, bring up the issue of record access, tell everyone about it, whether you agree with it or not. Let's get that discussion and debate going. Write to the PCT, write to the Acute Trust, to social services, to the out-of-hours service and say, what are you doing about this? How are you enabling it? Because we need to get that discussion going. And the second thing, I think, is we actually need to think about the costs of this, because there are some physical costs associated. The service itself is free. It's free for the patients, it's free for the practice. But you never get anything in life for free. There's a cost to having this meeting, there's a cost for the tea and biscuits. And the question, to my mind, is who pays for it? Is it the NHS? Is it the taxpayer? Is it the patient? Should we actually get the patients to start to pay for the service? Is that something that we want? Is it, for instance, Google and their model, where actually it's the advertisers? Well, you might think, well, that's great because I get it for free. But what about if you've got some small startup company that's got this new wonderful diabetes product and they decide to pay Google millions of pounds just so that they can get the #1 spot next to your name when you've got diabetes in there? How do you feel about that? What is the ethical dilemma there? Is that a problem? Do you think we should worry about it? What should we do about that? It's not Google. Who else could it be? Could it be a mixture? What about insurance companies? Well, there's a thought. Imagine applying for life insurance and the insurance company says, we'll give you a 10% rebate if you access your records. Even if you don't actually give the information to the insurance company, they might have worked out that those patients that are accessing their records are taking a greater interest in their health, they're more informed, they're better empowered, therefore they're likely to do better because they're more likely to follow the instructions or whatever it might be. How do you feel about that? Do you like that idea? Don't you? Those are the key questions. As we start to move forward, as we move away from 1 or 2 practices up to 100, 150, 200 practices, there's going to be a cost attached to this, and we're rapidly going to have to start to think about who pays for it, what sort of framework are we operating in, have we got the right